Good afternoon, everyone. Thank you for joining us again for our weekly press conference on Delaware's response to the COVID-19 pandemic. I'm Governor John Carney. I'm joined again by the Director of the Delaware Emergency Management Agency, A.J. Schall. A.J., thanks for being with us to talk about incredible efforts for testing across our state. And the Director of the Division of Public Health, Dr. Karyl Rattay. Thank you, Dr. Rattay, for all that you and your staff are doing. Just incredible work over the last 8 months now and continuing. Let's go right to the numbers. We're going to try to talk a little bit today about the new data dashboard. Dr. Rattay is going to explain some of the numbers behind the numbers, as well as we've changed, as you probably know, we're presenting now a percent positive that reflects both the number of persons that are tested and that test positive, and the number of tests that are administered, and those that test positive from that. It's a different number because people are getting tested more than once, and increasingly, as people get tested more than once, as we test more people, more of the educators, teachers, and staff in schools and students, that number is going to get bigger, AJ, and you have a big number to show for the difference there. And so we need to put that calculation in the context of our gate opening criteria for school reopening. And I should mention at the top the interaction that we've continue to have with school districts, with our superintendents, and the efforts that they and their staffs are making in getting children back in classrooms gradually. I was at Stubbs Preschool earlier this week and saw the little ones coming back, preschool children, so excited to be back in school, and their teachers so excited to have them there, all with their little masks on and keeping appropriately social distanced, with hand sanitizing stations at the doors, and that interaction that's so critically important. That's our objective. It's based on the public health guidance and data that you'll see in a few minutes, and obviously putting judgment behind and common sense behind the numbers that guide us. And so we're closing in on 25,000 total positive COVID-19 cases in our state. Sadly, the number of fatalities continues to go up at 686, each one a precious life. We've been focusing on the hospitalization number the last couple weeks, and that number had gone over 100 for several days there. Now it's starting to come back down. Obviously, some of those individuals were released from the hospital, so we are currently at 93. And as we talk to the hospital administrators and staff, they feel pretty good about where they are with respect to additional capacity. It's something that we have focused on since the early days last spring, seeing other states that have come up against their capacity. And the hospitals now obviously have other procedures going on, which is important for their patients and for the hospital operations and revenue. And so it's important that we keep our eye on that with respect to hospitalization and the capacity there. So 12,000, almost 13,000 positive cases in Newcastle County, 3,400 to almost 3,500 in Kent County, and 7,800, almost 7,900 in Sussex County. And you'll see in a few minutes where, again, Sussex County seems to be the area where we're experiencing higher new positive cases each day, centered in certain of the areas which we'll talk about. So here's what I was talking about a minute ago, our percent positive, which is a good indicator both of the number of tests that we're doing, which is the denominator for the total test, and then the number of persons tested, which is a measure of prevalence, as the public health people refer to it, so the prevalence by individual. It's a higher rate because we are testing more people more than once, and so you have 7.3% positive for persons tested and 3.4% positive for tests. So those are individuals who've been tested more than once. We're leveling off around 132 new cases per day, higher than where we want to be. We want to be below 100 and in the 90s or even below that. We had consistently been in the low 90s, high 80s in the latter parts of the summer. But as activity started to reoccur and people going back to school, starting with their college and university students, those numbers started to trend up. Now we're just seeing a little bit higher numbers geographically across the state, with certain areas a little bit higher than others. We're doing a lot more testing, which has some effect on that, and AJ will show you some of those higher testing numbers. But as we look behind the numbers and look behind the tests that are positive, we're not really seeing any big factors that are driving those new positive cases, other than kind of informal family gatherings, social gatherings that people let their guard down a little bit, maybe not wearing their mask. We'll have a slide later that shows how effective mask wearing is, and we've learned over the last 7-8 months that probably the most important thing people can do to protect others mostly is to wear a mask and to protect the spread of the virus. And the more the virus spread, the more vulnerable people are to further spread of the virus, because there's more of it active in individuals in the community. So it's important that we wear a mask, keep socially distanced, observe appropriate hand sanitizing. You can see again on this graph that demographic, the young adult demographic, continues to increase at a rate greater than the other demographics. And so that's a group that we want to communicate to and really get the message out that they need to be more careful and follow the protective measures. So here's our data dashboard with the 14-day view. Current hospitalizations are flattened out at a level higher than where we want them to be. Today it was in the 90s, but it had been above 100 there for a couple days, not increasing on any dramatic trend. As we talked to the hospitals, a lot of the growth was coming from our hospitals in Sussex County, which kind of makes some sense since the increased number of cases tends to be a little bit higher down there. The second chart on the top shows new hospitalizations. Again, that's trending down, which is a good thing. We have seen some outbreaks in our nursing homes again. Dr. Rattay will talk a little bit about that, which might drive these hospitalization numbers up, a week from now or some days from now. We know that this is a lagging indicator. And then the new positive cases, far right on the top level, you can see the gold line is up and down. It's very episodic now, mostly a function of the number of tests. AJ will touch on that. We're doing a lot of testing that results in results coming in 2 days later, and so you get a big spike. Today, our number was 80, which is low. If we could be at 80 every day, that'd be perfect. But yesterday it was 202, and that was because we had done a lot of tests. Go back 48 hours, and over the weekend, I think Saturday, there were a lot of tests that came in, or Sunday. And so you really need to keep track of the 7-day moving average there. It's pretty flat, as you can see, but again, at a level higher than where we want it to be. So on the bottom, middle and left side, those are the two calculations for percent positives. The percentage of persons positive is the far left. You can see it's a higher number, and it's higher because as somebody gets tested more than once, it doesn't get included in the denominator. When you calculate that, put all the tests in, the tests that are positive, the percent positive, gets to be about half of what it is on persons tested positive. So we're showing both of those measures because we're transitioning from one to the other to give everybody a very transparent view of a criteria that we look pretty closely at. The graph of the emergency department visits for influenza-like symptoms tends to reflect our experience over the last several months, with the peak there and the decline and the little tiny peaks after that. Here we have the 90-day view, and you can see on the top left the run-up in hospitalizations that occurred from the middle of August until more recently, and now we're leveling off. The new hospital admissions tends to be up and down, as you can see, the top middle. And then the new positive cases, which had been rising, and it's kind of very episodic based on the reporting from big testing days and not so big testing days. On the bottom, you can see the two calculations, methodologies for the calculation of percent positive. The one on the bottom far left is the person's testing positive, so excluding people who've been tested more than once. In the middle is the percentage of the tests, all tests, including second and third tests, and you can see that about half the rate, and again, the emergency department. The gloves came in, and so we're fully equipped here with PPE. All the vessels are completely full. We were waiting for those gloves to be delivered for some time. The next chart, you need to take a minute to kind of look at this, but it's a very interesting study that was done and published in the Washington Post. And it really simply says that states where people report wearing masks voluntarily are states that have have people who know someone with COVID, a lower rate of knowledge of someone with a COVID-19 symptoms. And so you can see Delaware is down there with about 95% of people who say they wear masks outside, and only 20% of them say they know somebody who's tested positive. Contrast that with South Dakota and North Dakota, and their reporting of people who wear masks outside is around 70%, North Dakota a little above 70%, South Dakota looks like about 65%, and they're up to almost 50% know somebody who is COVID-19 positive. And then you can see the distribution by geographic area. The far west, you have in purple, Wyoming, Idaho, Montana, who are up there with high knowledge of COVID-19 symptoms. The upper Midwest, kind of right in the middle, 80% wearing masks and 30 to 40% of cases. And the South, they're in the middle with the Midwest, and then the northeastern states, higher levels of reported mask wearing and lower levels of knowledge of people with COVID-19 symptoms. They're really a simple chart of showing what works and what doesn't work, and that is wearing masks work. It protects people from ingesting respiratory particles that come from somebody that's COVID-19 positive. And so, again, just to reinforce something that we've been saying now for several months, that if you wear a mask, you're helping all of us avoid COVID-19 positive. So we have some good news to report. Kent County just received notice that a new manufacturing site has decided to locate there in Kent County, actually two. Shoreline vinyl and U.S. corrugated, so several hundred manufacturing jobs during pandemic. Obviously, this couldn't come at a better time, and we're really delighted to report this. Linda Parkowski, who is the point person there for Kent County Economic Development, works very close with Kurt Foreman and his team at the Delaware Prosperity Partnership. And we're seeing several of these, as I mentioned, opportunities, I think 4 in total over the last year or so, of these smaller scale manufacturing, good paying jobs that are locating in Kent County. So some pretty good news in the context of the COVID-19, and obviously one of the more important things that we're doing is focusing on getting our economy moving again as we get control and push down on the spread of COVID-19 in our communities. So just a reminder to download the app on your phone, COVID Alert DE. It's really an effective way to identify whether you've come in contact anonymously with somebody who's tested positive for COVID-19. They alert the Division of Public Health, which triggers the app and alerts you on your phone that you've had that occurrence and that you should probably get tested to see if you're positive as well. Another bit of good news, we've been talking about Dolly Parton's Imagination Library. We've had 11,441 children registered to get these books, free books from Dolly Parton's Imagination Library, a really important step in getting our children off to a good start, reading books and having access to that. We're going to have a costume contest, and I can imagine the comments that people are going to be writing now on the virtual presentation here about what the governor might come as, and I'm not going to speculate on that, but we thought that we would add a little fun to things and ask you to post the costume on social media, use the hashtag #SafeHalloweenDE. It's an opportunity to wear a mask, wear your COVID-19 mask as well as your Halloween mask, and we'll repost our favorites on @JockCarneyDE. So with that, again, I want to thank Dr. Rattay and her team at the Division of Public Health for their continued great work. You're going to hear from Dr. Rattay about our data dashboard and to try to make clear to you the data that we're using, how it's changing a little bit given the change in the calculation for percent positive, the other data that's behind the 3 criteria that we use for school reopening, which is really our major focus right now, that in opportunities to gradually reopen other parts of our economy. And we can only do that with extensive testing, contact tracing, and focusing on areas where we're seeing outbreaks. We can only do that if we are controlling the spread, and we're a little bit higher than where we want to be, but we're certainly not as bad as many, many states across the country that are really experiencing significant increases, unfortunately. And a lot of that is because there are areas where mask wearing is, as we saw a minute ago, not as pervasive as it is here, and hats go off to every Delawarean for wearing a mask. I know even folks that object to being told that it's a mandatory thing to do are wearing masks, and that's a very positive thing for themselves, their families, and their communities. So, Dr. Rattay, I look forward to your presentation today.
Great, thank you so much, Governor. So, like every week, I want to start with the areas of concern that we're seeing in the state. And top of the list are still Bridgeville, Seaford, and Laurel. Delmar is showing some improvements, but still is one of the zip codes that has some of the higher case rates and higher percent positive. So appreciate so many people from Western Sussex coming out and getting tested, and we really want to encourage continued testing. AJ's worked hard to get some testing available in Sussex County. So again, we just want to encourage people to take advantage of that testing that's available. I also wanted to point out Bethany Beach, Fenwick Island, the zip code of 19930, which for the last couple of weeks has popped up there as having higher case rates and percent positive. So although the numbers of cases aren't that high, just want to make sure people in the Bethany Beach, Fenwick Island area are aware that we're seeing some higher cases, and again, encouraging people to take advantage of the testing that's available in your area. Also this week, Newcastle County is on the decline. That doesn't mean we're out of the woods at all in Newcastle County, but we did see some increased case rates and percent positivity in the Newport-Stanton area. So again, folks in that area, make sure you're taking advantage of testing as well. I also want to provide an update on our long-term care cases. We've talked about the 4 long-term care facilities where we've had outbreaks, Kentmere and Regency, both in Wilmington, both with the same zip code. So if you're noticing 19806 as what might look like a hotspot on at times on our website, it really is largely because there's large numbers of residents and staff in these facilities that have become positive. We also have Cadia Healthcare, Silverside in Wilmington, that's also been dealing with an outbreak, as well as Country Rest Home in Greenwood. Those outbreaks have all been going on for well over a month at this point. Newer is Laughlin Park Center in Seaford, which has now 21 residents and less than 10 staff who are positive. Over, though, the past couple of months, late October, September, up to now in October, we have seen cases in 55 long-term care facilities. So as we've talked about before, it really is critical that we're working very closely with long-term care facilities in our state. As we've discussed, they've gone back to weekly testing for staff, which is so very important. They've all been required to complete some new and updated testing that was to be completed by last Friday. And additionally, we have teams that are going on site when there are more than 2 cases in a facility to make sure that infection control infection control procedures are all in place as best as possible. Next, I want to shift to talking about our school reopening dashboard. As we've mentioned, we're making some updates to the school reopening dashboard on My Healthy Community, which is now live today. When you look at it, at this main dashboard, you're not going to see significant or obvious changes. But for us, it was important that not only it aligns with federal guidance, but also that we feel it best reflects levels of community spread. And since we did update our % positive measure to be test-based, we are now going to be using that metric, but we also then adjusted the threshold values. So you have to be less than 1% to be in the green, 1 to 8% to be in the yellow, and more than 8% to be in the red. We also did make an adjustment to the case rates as well to align with the Centers for Disease Control and Prevention recommendations. So on the next slide, you'll see what it looks like now. You'll see that there's a break between previous weeks and this week. That's because of the changing methodology. But you can also see we're still all in yellow, which if we hadn't made the changes, we'd still be all in yellow. But again, we're going to keep these changes moving forward from this time on. But we also wanted to do something which is add some more detailed information. We know a number of people out there are looking very closely at the data and really trying to understand what the data tell us about community spread and our response in Delaware. And so the Centers for Disease Control and Prevention in August came up with a dashboard that we have largely adopted here. What we like about this is that it does add some additional colors. It also shows you the rate of change for our key indicators. So it lines up or it syncs with the main dashboard, but for yellow, which is on the main dashboard, a pretty broad, a broad category, by looking at this more detailed dashboard, you can see if we're light green, which means we're closer to green, or orange, which means you're closer to red. But you also can see which direction we're headed in these key indicators. And also because testing is such an important indicator for us to effectively contain this infection, we've added an indicator on test rates in here as well. And this dashboard will help you see how we're doing with testing from a week-to-week basis. So if we go to the next slide, you can see what this shows up for Delaware. And I realize that this looks a little confusing, but we also know there's a number of you out there that really want this additional information. So when you look at this, you'll see we're actually orange for case rates, But if you look at the next column, you can see that we've actually seen a decrease in case rates of 7.3% in the last week. So it's just helpful to see the trend, right? When you see percent positives, you see we're in light green, but we've actually gone up slightly if you look at the 0.2% next to it. Same with cases. If you look at test rates. Test rates, we are doing really great as a state. We are in dark green, and this is a CDC established metric and threshold. But we did a lot of intensive testing a few weeks before, so a slight decrease in testing last week, but we're still in the dark green. So hopefully people will find this helpful. We also, if you go to the next slide, can see that we're doing this for counties as well. So this is Newcastle County, and you can see for Newcastle County, we're in yellow for case rates, and Newcastle County's gone down almost 10% in case rates in the last week is good. Let's move on to the next topic.
Let me interrupt there, because I think that's a really important point. Because the question that I get as governor, and we get all the time as part of our team, is, are you going to be everybody back in school when it gets to green? Or if when we go to red, are we going to close all the schools down? The reality is you got to look at the specific, the data, that other measures than the ones that we've been using to set the context, because it could be the fact that some of these broader measures are reflecting an outbreak that's happening in nursing homes, where you're really not exposing a lot of school children to nursing homes other than maybe through the workers, and you have to take that into consideration. Might be moving in one direction as opposed to the other direction in terms of the rate of change. And so all those will be a backdrop. We also know that the reality is to be in a hybrid state of learning or any kind of learning, we need to, at least for some time in the future, we're going to need to have social distancing and mask wearing. And schools only have so much space to accommodate that. And so we know it's got to be this back and forth supportive relationship between public health and our data and the circumstances on the ground and the school districts and decision makers with respect to what level they need to be in school or not. What I know is, and what I hear from most people is, the best situation is to have as many children in front of in-person teachers as possible. I was in Stubbs' pre-kindergarten program yesterday, and it was really fun to see the little ones coming back, and it was their first day back, and to see them with their little masks on and the interaction in the classrooms with their teachers and aides. And what we know is those children and the elementary school children and those with special learning challenges probably need to be in schools the most. And I know all the districts are trying to make that work and going to great lengths to do that, and we appreciate their efforts. These data and the expanded data dashboard, if you will, with the additional measures will help us to make those decisions on an individual basis. Districts are making those decisions on an individual district by district basis. We continue to believe that that's the way to do it, as long as folks are really going after that overall objective, which is to present the best educational experience for all their children. And every child is a little bit different, depending on where they are in school and depending on the learning challenges that they have. And every teacher and educator situation is a little bit different. So we're all continuing to work through it, and this should help us make really good, sound decisions in doing that. I'm sorry for interrupted, but I just wanted to set a little broader context, particularly as it relates to the overall objective that we all share, which is to have as many children in school as possible and as safely as possible.
Absolutely. Thank you, Governor. And we know that a lot of folks would love for things to be cut and dry and easy, but it really is complex how we interpret the data and the decisions that are made based on the data. But I think we've all along wanted to be as transparent as absolutely possible with the data, so that people can really follow along with us as we're looking at the data around decisions. So let's talk about elections. With Election Day coming up, we want to talk about safe elections, but also really excited about Delaware's participation with the Centers for Disease Control and Prevention on a survey study. So CDC came out with polling guidance this past summer, and Anthony Albence, who's our state election commissioner, has done really a fabulous job, not only really getting the guidance into the teaching the poll workers about the guidance, but Anthony was really readily willing to be a part of this study with the Centers for Disease Control and Prevention to understand, what do our poll workers know and what are they seeing? And so after the primary day, a survey went out to the poll workers, had an amazing 92% response rate, which is something we never see with surveys, but 92% of eligible poll workers responded to the survey and shared their observations, which are really, I think, a good story. 99% observed face covering usage by poll workers, and they said that 98% of voters were wearing masks. They also said that masks were available in the sites for people who didn't come with a mask. So this is all good news for us. They also said that 88% that said that the voting booths were spaced at least 6 feet apart. And in 80% of the time, there was one directional voter flow, and also that there were visual cues to remind voters to stay at least 6 feet apart. And so that's good news as well. 91% of respondents reported that frequently or very frequently, they observed the voters maintaining 6 or greater feet of distance from one another. So again, good story about what's going on in our polling places, and that voters really came prepared and following guidance to keep things safe. Now, like always with every study, and wait, I got ahead of myself. They also said that hand sanitizer was available for 82% of poll workers, and 94% of poll workers and 82% of voters, and that cleaning supplies were available. 93% said this. On the next slide, some of the opportunities for improvement, which is why these studies are done. It was clear that we needed some more training for poll workers around what to do if somebody comes with symptoms, and how to safely handle the situation so that individuals can vote without spreading illness to other people. So again, other than maybe adding some additional physical barriers like plexiglass stands, if registration tables are too close, and making sure that there's cleaning and sanitizing products available if there's an ill person. I think the Delaware results are very promising for Delaware polls being a safe place to go, but also, again, good opportunities to improve upon a couple things. Vaccine planning. As I mentioned last week, we'll provide updates on a weekly basis. Last Friday was the first vaccination task force meeting, where we had an opportunity to bring partners up to speed on our planning so far. There's going to be a lot of additional discussions as we learn more information from the federal government around vaccine. We also provided an executive summary to the Centers for Disease Control yesterday, and as soon as we get edits back and have it finally approved, we'll make that publicly available as well. And then finally, we just want to touch on safe Halloween. I love this infographic here, which with these little ghouls who are 6 feet apart and with face coverings. Our perspective is you can have fun this Halloween as long as we do it safely. So on the next slide, again, just as a reminder, we've kind of categorized activities in low-risk activities, moderate-risk activities, and high-risk activities. Low-risk activities really are happening in your home with your household, but there's a number of things that you can do for fun. Moderate risk activities involve going out of your home to do things like picking your own pumpkin or doing trunk or treat, but of course that involves social distancing and face coverings. Traditional trick or treat, we don't recommend this year, door-to-door trick or treat, but you can do trick or treating safely. I'll share my plan with you. Putting a table like 10 feet away from the front door, bags of treats, so that, I'm not going to be making direct contact with people, but still they can come up, they can get treats and go on their way. So that's just an example. I'm sure that people are going to have much more creative approaches, but again, it can be done safely. We do want to make sure people know that costume masks typically are not going to count as a face covering, that it needs to, again, follow the normal face covering, 3 layers, preferably cotton material. So make sure that the face covering is safe, not the plastic costume masks. But again, there's a lot of fun things that can happen, but please don't hold household parties with lots of people inside your home without face coverings. And with that, I just want to say, we know Halloween may look a little different this year, but the important thing is everyone can stay safe and make sure that you're following at all times the guidance of staying home with if you're sick, wash your hands as often as possible, use hand sanitizer even more frequently, always wear a face covering when you are out of your home, and stay at least 6 feet apart, especially when you don't have a face covering on. And with that, I'm going to hand it back to the governor.
So thank you, Dr. Rattay. Some really good information there with the expanded data dashboard to give a deeper context with respect to the community spread and the conditions on the ground as we make decisions to move children into classrooms and to do it as safely as possible. Great information about the primary election and the surveys that were done. Special thanks to our Elections Commissioner, Anthony Albans, and the poll workers who worked the polls during the primary. I think it was the largest turnout on a primary that in the history of the state, and it was done safely. But just a reminder to, if you have a vote by mail ballot, we get it in as soon as possible this week, certainly by Friday, and to those of you who are going to vote in person, to make sure that you wear a mask to keep everybody else safe. I saw on that expanded dashboard, AJ, dark green for testing. I think that puts us in the top criteria, so good work.
It's good news, definitely. Thank you, sir. So going to start today, and usually go through the sites, but I think we want to go through just kind of a testing at a glance, go over some of our successes that we've seen over the last several months, and we still have more work to do. So since the beginning, since middle of March, we have tested 343,000 individual people, and collectively 542,000 tests have been administered. So they're actually PCR tests that have been given to somebody, ran in a lab, and results provided back to the individual. So we know a few weeks ago, Public Health rolled out the dual displays, 4% positive. This is kind of the denominator if you want to look at those numbers from the beginning of our COVID crisis. On a monthly level, I think this is a great chart here. So we started our community testing with multiple partners back in May. Dr. Rattay gave us a goal of 80,000 individuals with the asterisk of we want to provide testing to people that need to be tested as soon as possible, kind of being that like intangible goal, but something we knew we had to strive for. June we got pretty close. July we had some upticks down at the beach, helped us get some sites that might have been underperforming, moving up a little bit. So that was our high water mark, 107,000 during the month of July. As we discussed before, we started to see a decrease in August and September, and then really put our heads together to figure out what we could do to capture additional people, knowing that people are returning to work, children are going back to school, schools were trying to identify when their hybrid model is going to start. Some started back closer to Labor Day, some are starting just a few weeks from now or a few weeks ago. So we are at 100,000 as of the 23rd of October. We will probably close the month around 110,000, 112,000 tests. So I think that's going to be our new high water mark, and probably the goal that the governor, Dr. Rattay, keeps pushing us for as we go forward. So kudos to everybody that's helped make this possible.
Yeah, those are really great numbers, AJ. I didn't ever think that we were going to get to 80,000 when we put that up there as a stretch goal, and you can see from almost hit it in June, and then kind of July, August, September, and we're well over already in October. And again, the relevance of that to the number of positive cases, obviously, is that the more people that you test, that you're going to end up with more positive cases. The other important factor is to see that difference between the number of persons tested and the number of tests done completely, because we've got so many people now, there you go, being tested a second time. Sooner or later, that total of tests, persons tested, is going to just continue to rise at a rate consistent with the population and the number of tests. We're going to be twice as many tests done.
Absolutely, and I think, just think about the total person tested number. We're providing access to schools for teachers, faculty, staff to get tested, monthly, if not more, if they need to be. So, that's going into that right side denominator, but that, the total persons isn't increasing. So you have to dig down into the data, and I think that's what Dr. Rattay was explaining a few minutes ago is, it's there if you want to look at it, but at a high level, we have some of those scorecards. And so we did launch right after Labor Day the static community sites, 18 sites. We just added one additional Walgreens last week to really be that foundation. But we know these community sites that we are doing, these pop-ups, drive-throughs, depending on the model and the mode, are where we are having the most success. And if you look, we've kind of been in that 50 to 60 range. October, we're going to end with right around 74 sites, it looks like, which is due to the great partnership we've had with Newcastle County and the county executives team to support us up north, the National Guard, the team at Public Health in DEMA to really make sure we operationalize these and be as successful as possible. I expect our sites to, I don't know if we'll be at that 70 number going forward, but it's going to be in that ballpark as we go to the next slide. We had 22 events this week, but we also, 3 weeks ago, we brought a trailer that curative tests are being done out of that lets us kind of get into a little bit more micro at the community level. So instead of needing a huge parking lot or high school to test people, we're able to put it in a library parking lot or a smaller footprint to serve people. So we now took delivery of 2 additional trailers on Saturday, rolled them out yesterday. So just between those 3 trailers, we'll be able to do 15 sites a week around the state. We'll continue to do some of the drive-throughs where it makes sense, where you have the volume to support the logistics needed. The map there on the left of this slide is a snapshot of just the curative testing locations for this week. Some of those are state service centers, but the rest are the pop-up sites. The ones that are in gray probably were in the last day or two. They gray out until we get 3 days out from a new site there. So as you see, we have testing across the state. We do have testing planned for the Middletown area as well early next week. It's just not loaded in the system yet, but go to de.gov/get-tested, go to curativetest.com to make sure you can identify what works for you and what might be close to you. The hours will vary a little bit, so some of the drive-throughs right now are from 2 in the afternoon to 7:30 or 2:30 to 7:30, depending on the site specifics. The trailer options are 10 a.m. to 6 p.m., so we want to make sure we have an opportunity to get people that might work a little bit later shift, or those that get off from a traditional shift, get students after school as they're on their way home. So please go check the site, because it's not a one-size-fits-all plan. We've actually modified the trailers as well with lights. This weekend we changed the clock, so it's going to be getting darker even earlier right now, but we still want to make sure we are having opportunities a little bit later in the evening to address those that have a little bit more difficult schedules with just something in the middle of the day. We also know this data is only as good as how quickly somebody gets the results. We could go back to March and April where we were hearing 9, 10, 11 days sometimes for people to get the results back, which we knew had to be improved. There was only a few labs. There was shortage on reagents, and on swabs, on the collection material. So, Curative has provided us great real-time analytics of our samples, so what we are collecting here in the state and when the results were getting delivered. Last week, or actually for the last 14 days, the average has been 30.5 hours from the time the collection is taken, so the time the person checks into the testing site, to the time that they're notified. We are working with Curative in expanding courier pickup, so there will be some sites that might be sending 2 shipments a day down to the lab to speed that up, and our goal over the next several weeks is to get that down to 24 hours. However, we do have great success stories as well. Last week, I got a text message from somebody or 2 weeks ago, they went to Frawley Stadium. They got tested late afternoon. They woke up the next morning, so with about 12 hours later, they already had the results back. So that 30.5 number, it's important that we get that down, because as soon as somebody knows they get the results back, they know that they are positive and have to take those protective actions for themselves or families, and then it helps public health with the contact tracing and additional notifications. So we're going to keep reporting out on that average time and working to reduce it as well. And then the other pillar of our testing strategy right now is the at-home testing process, which has been very successful. Again, we're about we're under a 48-hour turnaround time once it gets to the lab. A lot of times that depends when somebody drops it off in the UPS box, and then it gets to them. So we know that they are not going over that 48-hour period, but we also have to make sure people understand, UPS boxes might not get picked up on a Sunday. So if you drop it off Sunday night, it's not going to get picked up till the end of the day Monday. They won't have it Tuesday. So we have to work that in there. We've been using this for the schools for about 6 or 7 weeks now. Very successful. We've opened it up to the public. Have been doing about 4,000 to 5,000 a week for public that might just want this convenience. And really, I know we're going to hit this hard as we go into the holiday season. We know people are going to travel. We want them to do it safely. We want them to be smart about it. We want to lower the risk. This is the perfect opportunity for testing when you're going to be going over somebody's house or you're going to be traveling. You're able to almost map it out to the day of when you're going to get your results back. Back that up, order the test, get on the Zoom, meet with the nurse, drop it in the UPS drop box, and you'll have your results in 24 to 48 hours. And we can help everybody lower the risk as they go into a very busy time of the year. And it's going to be, we talked about the new normal, but I think we know people are still going to want to see their family and loved ones over the next few months. So we want to make sure people use this to their advantage over the next several weeks. Requirements: you live in Delaware, you have an email address for every individual that requests it. So the way the system works with Vault is only one active email address is able to be registered at a time. So if I wanted to get tested with my 2 sons, I didn't need 3 email addresses to use to do that simultaneously. And then you need a smartphone or a tablet to be able to do the Zoom session with the nurse. So again, that information in the portal to request that is at de.gov/gettested. So with that, remember that all our testing sites are put online, as well as those of our partners that we work with, the clinics, the hospitals, some of the the federally qualified healthcare centers as well. There are a lot of options to get tested, so you could probably find something in your neighborhood and your schedule pretty close. So, Governor, back to you.
Yeah, so great job, AJ, and the team, partnership with Newcastle County to really blow through that 80,000 goal, 80,000 per month tested goal that we set several months back, and it puts us up there among the top states in terms of testing, which is just a really important way of measuring the spread of the virus in our state, so we can make smart decisions about opening schools safely, so we can make smart decisions about bringing folks back to work, and so people can get an understanding of areas that in our state that have higher levels of spread than others, and how we can all pitch in to flatten that curve. This at-home testing, AJ, the Vault testing is something I did myself. I would recommend it. You just get online, and they have a nurse that comes on, walks you through it. You do the swab, put it in the tube, and off it goes. And just in, I don't know, a day or two, I don't remember exactly, the results came back, and it's very convenient. And you're saying 4,000 to 5,000 per week. It is a very convenient way of knowing your status, which is something that's really important. You can know where the testing sites are by going on to de.gov/get-tested, and all the sites that AJ talked about will be up there. You can get information about your at-home vault testing with the public health nurse that comes on and walks you through it. Really critically important. Don't forget to download the app, COVID Alert DE. It's a really good tool. I know the last time we counted, it was over 50,000. So we're making progress in getting more people to voluntarily sign up and do it anonymously. And again, get your flu shot. One of the concerns that we have now as we move into more of the indoor season, it's starting to get chilly out there. There's not going to be as much outdoor activity as has been the case in the last several weeks and obviously through the summer. So make sure that you fight the flu and get your flu vaccine shot soon. And also remember, again, let's think about what works and what doesn't work. We know what works is to wear a mask. And again, wearing a mask is mostly to protect others from a virus that you may be spreading and not know about it. We know so many people that are test positive for COVID-19 don't have symptoms. Obviously, if you have symptoms, take cautionary action to stay at home, get tested, and make sure you know of your status. Keep distance, 6 feet appropriate distance when you're out in public, wearing that mask, appropriate hand sanitizing, and get tested periodically if you're going out of town to visit relatives, if you're having relatives in. My sister just came in to visit and got tested before she got here. Obviously, she was going to visit our almost 90-year-old mother and didn't want to see any risk associated with that. Download the COVID Alert DE app and make sure you protect your neighbors. So with that, thank you for joining us again. We have questions. We have media in the room, and we have some pre-submitted questions that we'll answer as well. Again, thanks to Anthony Albens and his team of poll workers for their work during the primary and the expected work that they're going to do next week.
How are you, Governor?
Hi, Sarah.
I have a question for Dr. Rattay first. You mentioned that Laurel, I think it's Laurel, Bridgeville, and Seaford, right, are having the kind of an uptick, right? There's kind of a lot of the virus is pretty prevalent down there right now. Do we know why this is at this point? Or have contact tracers found anything specific about either do we know who's getting the virus down there and why this is?
No specific reason why we have higher numbers in that area. We do know when we look at our contact tracing, some of the risk factors that we're seeing broadly is, gatherings, social gatherings, and obviously it's important that we have compliance with face covering and social distancing as well. That is an area of our state that actually hadn't really had an uptick like this before now. So that may be part of what's going on as well. They may be really kind of getting their first wave in Western Sussex, which is a possibility. But certainly, we're working with community partners to really try to increase testing in Western Sussex and also get the message out around the importance of those protective factors, including, not gathering at this point in time with others outside of your household unless you're with a face covering and distanced.
So just one thing to add to that for Dr. Rattay is, she shares this information with us, and we also use that to go back to the school district. So Delmar and I believe Laurel are on our list for the next week or so as well to get down there. So with the other community testing, we'll actually do a little bit more detailed approach with the school districts as well.
And with respect, if I may, with respect to outreach too, we have a weekly call with the mayors. And so in a case like this, and as was the case with both the University of Delaware students and Delaware State University students going back, we talk with the mayor of Newark, the mayor of Dover. When the beach outbreak, we had the beach outbreak, we were on with the mayors first thing. And we'll do the same here with Mayor Schwed and Laurel, Mayor Schall and Seaford, just to tell them, we need to get more people tested and try to get some coordination there. The districts, school districts down there also have direct communications to their parents, and that's a good way of getting folks out to get tested.
So to be clear, who is it? Do we know what the demographics are? Are these younger people? Are these high school students, or do they tend to be older who are testing positive?
Yeah, I can get more detailed information for you
Sure.
around the demographics, but just my, broad observations are that we're not seeing, a particular age group. It's not like in Newark where it was the college-age students.
Okay.
It's, it is a wider, in fact, a little bit older age range, and no specific demographic group as far as race or ethnicity. We're just seeing, more community spread in that area.
Okay, that's interesting.
And if I could just add another observation point to that, as we asked, and again, of course, this is somewhat anecdotal, but as we asked the hospital leaders there about what they were seeing, was there any particular demographic that stood out over above the other? And the answer was no, that they were just kind of a broad range of folks that were coming in and needed to be hospitalized.
That's interesting. Governor, I did want to talk to you about the election, which is a week away. I know that you've been staying away from the process of it because you are on the ballot, but we have been hearing from some voters and voting rights groups and voter advocates and even some poll workers who are concerned about voter intimidation this year. These people that we're talking to tend to be from the left. And of course, the Attorney General just came out with some guidance on voting rights, what people need to know about voting rights and how to spot voter intimidation at the polls on Election Day. I wanted to give you a chance to just talk to your constituents who plan on going to the polls on Election Day about whether they need to be concerned about this more than usual, what they need to be aware of in terms of voter intimidation.
Yeah, so we've heard a lot of that, and some of it is misinformation and social media about there going to be this kind of intimidation and that kind of intimidation. We have internally there have been meetings of kind of law enforcement agencies. Obviously, they do not want to be present as much to be an intimidating factor themselves, right? But just having communication among the various agencies, federal, state, and local, with respect to what they're seeing on social media in terms of these kinds of threats, that if these kinds of people are going to be there and threatening you. My own experience is that there are enough independent and party-affiliated poll workers that are always at the polling places, providing a level of comfort locally. They're mostly locally known people, whether they're Democrats or Republicans. They stand out in front of the polls. I've been doing this now since my first election in 2000, and then working with other candidates before that. I've never really seen that. We see it more on primary day, frankly, than in general elections. And so I would just ask people to get out and vote, exercise their right to vote. There are agencies that are kind of behind the scenes making sure that there aren't threats on social media and that they're not going to carry through with those threats. They're also very conscious of not being really out in front because of just the perception that itself is a threat, if that makes any sense. And we do have teams looking at the cyber threat side of it. So just to reassure voters that the concerns that they have, we understand where they're coming from, and we're trying to get ahead of each of them.
So another concern for this election, it was touched on during the first presidential debate, is potential civil unrest after the election. Is the state preparing in any extraordinary ways, in ways that they haven't done for elections prior, to prepare for potential civil unrest in Delaware due to the election?
Yeah, I am really very confident that it's not something that we would see here. Does that mean we're not preparing for it? No, it means that there is a very difficult balance to strike, to be prepared for that kind of a situation and not be out front, again, so as to bring concerns about intimidation, right? You don't want a really hard law enforcement front to suggest that people should or shouldn't go to the polls, if that makes any sense. But there has been, a lot of the concerns are risen by some of the rhetoric at the national level, by some of the threats that we've actually seen on social media, some of which have been the result of foreign actors, which is really very disturbing. But I'm confident that we'll be prepared for whatever happens on Election Day and after Election Day.
Thank you so much.
Thank you.
All right, first question is from Amy Cherry at WDEL. What do you think of the County Executive Myers' plans to use CARES Act funding to buy a Newcastle area hotel and turn it into a homeless shelter? Is this something the state would consider partnering with to provide services?
Yeah, so I don't know a lot about the proposal by the county executive. I do know that the challenge of homelessness has been a real serious one, and one that we responded to early on, led by Lieutenant Governor Bethany Hall Long. She led a group of community activists and workers, community health workers that were mobilized to approach those who are homeless or suspected to be homeless, make sure they had personal protective equipment. We directed those and made available space in hotels that weren't otherwise taking folks into the hotel at the time, and there were several of those across our state. And so it was a big focus. It was to a certain extent term limited, and so the question gets to be, what do you do now? I think the big question with respect to this idea, which is a creative idea, there is some concern about the particular location of the facility kind of being out without access to a lot of services. A lot of the homeless shelters have other services that are provided by nonprofit organizations located pretty close to the facility, is what is the long-term plan. And I'd like to learn more about what that long-term plan actually is. But the idea of concern for homeless populations and what do you do in a COVID situation obviously is one that was responded to aggressively by Lieutenant Governor Hall Long and scores of others. We used that same framework to respond to the outbreak among poultry workers in Sussex County when that occurred in mid-April and the end of April.
Next question is from Amy Cherry at WDEL. The federal government says it's sending 290,000 rapid antigen COVID-19 tests to the state. The hope is the tests are used at your discretion to test educators and students as well as first responders. Is that how you plan to use these? Do these tests come at a crucial time? And is Delaware at all close to running out of curative tests?
So I'll take that, and AJ, please feel free to add into anything I miss. AJ and the broader team have, I think, worked really hard in finding a diverse portfolio of tests available to us in the state. We have a test plan for testing students and staff as schools continue. We rely heavily on the PCR test, which is an accurate test. Curative is one of those tests. We don't have concerns about running out of curative tests. We're going to continue to replenish and build the supply of curative because it has been such a successful program for us in the state. But we have a number of other programs and partners that we work with. The specific tests that the federal government is sending to us, these Binax rapid antigen tests, we're getting about 15,000 per week. We certainly have a place for them, but we do have concerns and caution around this test. This test doesn't perform well if the user isn't well trained. We get false positives from this test that can be problematic, usually from user error. And the FDA has really only approved this test for testing people who are symptomatic. And so the place where we're using this test is with primary care providers and pediatricians in our state, who are individuals who are used to using this type of test, like the rapid strep test or the rapid flu test. They know how to interpret the results. If it's a false or if it's a positive, they'll understand the protocol and how to back it up. with a PCR test. So we just feel a lot more confident in having this test be used in a medical setting, like with primary care providers, including pediatricians. And so that's how we are planning to use it in our state. But it's not filling a huge gap, and it's not because we're concerned that we're running out of the other tests.
No, so I think the only thing I'd add to that is, we showed the graph before of, performing close to or over 100,000 tests a month. So I think this is just another way for us to diversify that and provide another option, and let's use it where it's most accurate, and that way we communicate correctly with the public.
Next question's from Rob Torno at the Philadelphia Inquirer. While Pennsylvania and New Jersey have experienced a surge in new cases, Delaware has managed to keep new cases relatively steady in October, especially over the past week. How has Delaware accomplished this, and is it sustainable throughout the fall and winter?
Well, I hesitate to answer this question because I don't want to jinx this. I do remember when Delaware was on the quarantine list for both Pennsylvania and New Jersey, and that is concerning. I think I'm going to defer to Dr. Rattay, but I would be speculating. I happen to believe, though, that we're doing the kind of extensive testing that DJ just talked about. We're, I think, getting ahead of some of these surges that other communities are seeing, particularly in higher ed. We work closely with the City of Newark, University of Delaware, and really pushing down the spread that we saw off campus there. Same thing with Delaware State University. The numbers out of Newark and Dover right now are pretty flat. So we, I think, have a network of data and connections and communications that enables us, in a small state like this, with our partners to respond pretty quickly. But we're not, by the way, and the Delawareans, I think, by and large, as we saw from the face mask wearing data, following the guidelines wearing masks in public. Having said that, we're not where we want to be. We want to be lower positive cases, and the growth rate, we are flat with respect to that. Hospitalizations are flat, but at a level that's too high for us, and so we want to push that and continue to lean on the protective measures that we know work. Dr. Rattay, any thoughts there?
I'm not sure I have a lot to add. I mean, I think we all would love to have a crystal ball which shows us that, we're going to be able to maintain where we are or even decrease cases. But I think we all have concerns about what the winter is going to bring as more and more people spend more and more time outdoors. There's certainly, new theories that the drier air in winter is more able to spread the vesicles more easily, but we should be very proud as a state for how we're doing as far as whether it's the face coverings or the decreased gatherings that I see so many people following, and as far as our testing and our isolation and our contact tracing and our quarantine, we have built a robust system to be able to contain this infection as best as possible. So, we can only hope that crystal ball with an optimistic view is correct, but we are prepared for this to get worse.
Next question is from Sean Green at WDEL. We're now 1 week into high school sports competition, and there have been pictures of parents who are not allowed to watch sporting events congregating along fence lines, or in one case, a scissors lift just to get a distant view of the action. What was Governor Carney's and DPH's reaction to what they saw this week?
Well, I didn't personally see people standing at fences watching sporting events, but I can tell you I have stood at fences and watched more football games than I'd want to admit. I used to, on a regular basis, I live about 3 blocks from Baynard Stadium, and I used to go over to the stadium and watch the first half outside of the fence, and then when they took the ticket takers away, I would go inside and watch the second half. I certainly appreciate the desire of parents to see their young athletes compete in whatever sport it is. There's just nothing like it. But this is really about getting the kids to play again, and we're very concerned still about the spread of the virus. We know that it happens when people let their guards down. And so most school districts that I know of, most the teams are allowing, 2 parents, I think, to come into the stadium and limiting the number. And that's an important thing. And people just need to follow those social distancing guidelines and mask wearings, and that'll certainly help prevent a spread of the virus. We certainly wouldn't want to see sports having to be shut down because spectators didn't follow the rules with respect to distancing and parental involvement. But I certainly do appreciate the desire to see your young athletes competing.
Yeah, I mean, these are local decisions made by the districts or the schools themselves. Our guidance does, we do have very specific guidance around safe spectator, watching of games and attending events. But again, this is a pandemic. I guess my first thought when I heard about people lining up against the fence is I hope they were social distance and wearing face coverings. And I think, that tends to be where my mind goes. But again, I do sympathize with parents. I had to miss both of my son's soccer games last week. And frankly, I'm just really happy that he's playing.
Next question's from Sean Green at WDEL. We've now seen a few examples of high school sports teams in Delaware shut down for 2 weeks as a result of a COVID-19 positive case around the program. What is the standard DPH is using when making a decision whether a team or just an individual will have to quarantine?
Yeah, it's a great question. So every case is handled individually. And so there's no, again, cut and dry decision that's made. It's really based on the person who's positive and who, during their infectious time period prior to their diagnosis, who were they exposed to? Who did they have close contact with, less than 6 feet, without a face covering? There are certainly circumstances in which, we've provided guidance that no teams, no classrooms are impacted in any way if we don't see any evidence of close contact. But schools and districts need to make their own decisions. Often they have different dynamics that are separate from the science that our epidemiologists are looking at. But we are looking at, was there close contact and with whom, and that determines how many people and who needs to be quarantined.
This is the last question. It's from Tim Furlong at NBC 10. Governor, could you give a final take on Halloween this weekend?
Well, I remember back in the spring and the lead up to St. Patrick's Day, I was the Irish governor who had to cancel St. Patrick's Day. That wasn't a very good place to be. And I certainly didn't want to be in a position of canceling Halloween. I would just ask all Delawareans to celebrate Halloween in a way that's safe, that follows the guidelines with respect to mask wearing. Obviously, Halloween is a time where we wear masks, and I would wear a protective mask and then whatever costume the little ones want to put on. And I would observe the appropriate restrictions in terms of making treats available to those who come door to door, and maybe even to be careful, obviously, with children going door to door, and certainly keeping the mask on and appropriate social distancing. And hopefully we can have a safe Halloween, because the objective really in all of this is to continue to push the spread down. We are seeing more of a flattening out of the cases. We've had higher levels of cases than what we want it to be. We want to push it down certainly under 100 per day, and we won't get to where we want to be until we're considerably better than that. We're going to continue to test. We're going to continue to communicate to folks across the state to wear a mask, to keep appropriate social distance, to wash your hands appropriately, to get tested. Lots of opportunities to get tested. You can do that by de.gov/gettested and find all the testing sites that are available. If you have symptoms, stay at home, quarantine yourself, find out whether you're COVID-19 positive. Would also encourage folks to download the COVID Alert DE. It is another tool to help you know whether you've been exposed to somebody who's tested positive of COVID-19. You can do it anonymously, and it'll help you in the long run. So I'm confident that we can do better, that we're going to do better. We're better than most states at the moment as we go into Halloween, another opportunity for folks to show that they can follow the guidelines and follow the restrictions. And at the end of the day, we're going to get through this, and we're going to get through it by working together. So thanks for joining us, and we'll see you next week.